Polycystic Ovary Syndrome, or PCOS, is a complex condition that affects hormones, metabolism, and fertility. Insulin resistance is a metabolic condition that affects most people with PCOS. Your doctor may have recommended that you follow a low glycemic index diet. Here are 5 reasons why this diet may not be right for you if you have PCOS or any insulin resistance, and 3 alternatives to glycemic index that you can try. Hi, my name is Dr. Basma Faris. I am a board-certified OBGYN and nutritionist who specializes in PCOS. The glycemic index is a numerical system that ranks carbohydrate-containing foods based on how quickly and how high they raise blood glucose, aka blood sugar levels, over 2 hours relative to pure glucose. It was developed in the 1980s as a tool to help guide food choices in people with diabetes. Foods that raise blood sugar less over the course of 2 hours have a lower glycemic index. Recent studies have put the benefits of using the glycemic index to manage diabetes into question. The reasons are the same reasons why it might not make sense for you if you have PCOS. The first reason is the glycemic index does not take into account portion size. So a larger portion of a low glycemic index food may have the same glucose response as a smaller amount of a higher glycemic index food. The second reason why a low glycemic index diet may not help manage your PCOS is that it doesn't take into consideration how we eat mixed meals, or meals with multiple components. Different food combinations may impact how our blood sugar responds to that meal or that particular food. You might think a food is off limits due to the higher glycemic index, but pairing it with other foods may lower the glycemic response. As a result, you could be avoiding some foods unnecessarily. A third reason why a low glycemic index diet may not be as helpful as you think is that food preparation methods may change a food's glycemic response or glycemic index. For example, cooking a starch longer may increase its glycemic index, while cooling it after cooking may lower the glycemic index. Reason number 4 why a glycemic index diet may not be ideal is that it doesn't take into consideration individual responses to food. One food may be digested and absorbed more quickly by one person than by another person. A low glycemic index food may not be low for another person. Lastly, the 5th reason why a low glycemic index diet may not be right for you is that a low glycemic index food is not necessarily a health food. The glycemic index doesn't tell us anything about nutrition quality or nutrient density, which is the amount of nutrients in a food. There are alternatives to the glycemic index that you can use to help you decide what foods to choose. My favorite is to use a carbohydrate to fiber ratio. If you look at the nutrition facts label, you can find the amount of grams of total carbohydrate in the food or in the portion of food, and also the amount of fiber in grams. Doing some simple math, you can calculate the carbohydrate to fiber ratio. A ratio of 10 to 1 would indicate a good source of fiber, and a ratio of 5 to 1 would be an excellent source. High fiber carbs tend to raise your blood sugar more slowly and are a good source of sustained energy. They also help to support a healthy gut. Foods that have an excellent ratio are beans, broccoli, and blackberries. Ezekiel sprouted bread is another good choice. Secondly, similar to the glycemic index is the glycemic load. It considers the glycemic index and the portion size. You can look these up in a reference table. The third method to evaluate carbohydrate-containing foods is the Carbohydrate Quality Index. It is a scoring system that takes into consideration the glycemic index, the fiber content, whether or not it is a solid or a liquid, solid being better, and the whole grain content. Similarly to the glycemic load, you can look up your foods on a reference table. Instead of following a low glycemic index diet, instead focus on creating balanced plates that contain adequate fiber and protein, low refined carbohydrates like sugars, and always seek the help of a nutrition professional who can help you create a personalized plan. If you are in New York State or any of the 12 states that I am licensed in and would like to schedule a telehealth visit with me, you can check out the links in the description. Remember to hit like and subscribe, and I will see you in the next video.